morning, everybody. How are we all doing? Good, good. All right. So, kind of go over some basics here. So, again, my name is Eric Warne, chiropractor with Grand Itasca. I have been present with the clinic for the past year. So, I'll give you guys a little bit of background about myself, education, hobbies, things like that. We'll talk a little bit more about acupuncture, how it actually works. Try to hopefully give a little less mysticism surrounding this form of healthcare. So a little bit about me. I graduated from Concordia College with a degree in biology. For those of you that were here this last winter, I talked a little bit about how I had zero interest in going into the field of chiropractic. Believe it or not, I was getting ready for medical school. And then 2 weeks before I graduated college, I changed my mind. Don't do that. Anyway, then I attended Palmer College of Chiropractic in Davenport, Iowa, where I earned my doctorate in chiropractic. Once again, I had very little interest in pursuing acupuncture, and then the previous employer that I worked for asked if I would be willing to learn how to do it, and I said, sure, why not? I'm picking up a pattern that I do this a lot professionally. So a little bit about just kind of myself. I grew up in Marshall, Minnesota, southwestern Minnesota. Yep, that's the world famous Duke. He is my 10-year-old English Springer. And that's about anything that we're going to remember from tonight is a very nice dog. Again, he's my pride and joy. Usually you can find myself and Duke. We both love doing anything outdoors. He's trained pheasant dog, so obviously we go hunting. He doesn't like boats that much. I like fishing. That's kind of our only drawback. Also, too, I'm very, very active with exercise, fitness, things like that. I help coach at the CrossFit gym in town occasionally. And then also, too, I'm very involved with music, not as much as I'd like to be. Currently, I have the opportunity to play music with Grace Bible Chapel from time to time, which has been a phenomenal, phenomenal joy to be able to do. And yeah, give everybody a couple more seconds looking at Duke. So, all right. So a little bit about the training to become certified to practice acupuncture as a chiropractor. So as a chiropractor, to be certified to get the proper training, chiropractors have to undergo 200 hours of additional coursework. Now this can be done either during your time in school. I chose to do it postdoc. Again, both ways work very well. There are similar programs for other healthcare practitioners, including medical doctors, DOs, PAs, NPs, whatever other alphabet soup you can usually mix and match there. There's usually a program to facilitate that. Now, for somebody like Amy Dolan in town, she actually has a master's degree in what's known as Oriental medicine. What's the difference between that and what I went through? Well, they're going to go through a lot more in the realm of theory, application of acupuncture, not to mention other methods of Chinese herbal treatments, gua sha, cupping. All these different avenues are pursued a little bit more in depth. So, like I talked a little bit about, or mentioned real quickly there, traditional Chinese medicine. Now, this is the most commonly known form of acupuncture, most commonly practiced. History is a little bit murky about whether or not acupuncture actually began in China or not. There is some evidence to suggest, yes, it did originate in China. However, we are also finding evidence to suggest that as far back as ancient Egyptian times, sailors would sometimes pierce their ears to heighten senses, most notably vision. Did it work? I have no idea, but there's a lot of theory behind that. Now, there's also other forms of acupuncture out there, including Japanese, which is very similar yet very different to Chinese, and then there's also various forms of European styles. We're actually going to discuss one of those tonight, which utilizes treatment of the ear. Now, the picture of the man on the side there are basically what we're going to be discussing next is called meridians. Now, meridians are basically just channels within the body. I'll try to break that down and give a little bit more clarity on that. Again, just trying to mystify stuff, but this is kind of the basic premise behind Chinese traditional medicine. So the whole premise of acupuncture from Chinese medicine is this idea of qi. So chi is energy, and energy flows in the body. Now, again, in this day and age, we need to kind of, okay, energy, well, that can mean anything from blood flow, lymph flow, nerve impulses, muscles, all these different things have to move. And if that becomes disrupted, there's stagnation, different things like this. This is how illness, disease, dysfunction begins to kind of manifest. So acupuncture tries to restore normal flow of energy by stimulating these various points along those meridians. Now, how did that actually come about? A lot of trial and error from what we can find, but we found that over the years, a lot of these traditional healthcare practitioners would find something very similar. So if the needle went in at this spot, you could help X, Y, or Z, or something along those lines. And that's how they eventually began to map out the different meridians, also these different points. I'll talk a little bit more about what those points are a little bit later on, so forgive me, we'll kind of be jumping back and forth, but stay with me, I am trying to explain this properly. A lot of stuff to cover here. So, let's talk a little bit more about those meridians. Again, these are what are known as organ lines. Now, why are they called organ lines? That's what they found initially they could treat. So for example, one most common one is called the bladder line, and that's going to run up the back side of your leg, up your back, and kind of continue up into the face and scalp. Did this have a lot to do with the function of the bladder? Somewhat. Actually, believe it or not, this is one of the most commonly treated channels for low back issues, sciatica issues, things like that. So in some ways, yes, the organs themselves, the meridians named after stomach, liver, what have you, will have something to do with the actual organ. Sometimes they don't. Why? Good question. I don't have the answer for that either. Again, a lot of this is going to come from observation from ancient times where they didn't have our knowledge of anatomy, physiology, and things like that. So once again, let's think about this meridian or these channels throughout the body as kind of like an interstate system. This is how your body is going to take energy from the outside world in the realms of food, drink, air, process it, make it into things that we can use. So energy from muscle contraction, brain power, all these different components, and then that energy leaves our body. Again, that's that cyclical flow. Once again, these acupuncture points are typically found along these channels. Now, I've tried looking into research as far as why points are where they are located, and there is nothing definitive to say this point is here because of this. What we're thinking is that there's areas that are a little bit more densely localized with some type of a neural supply, but nothing is consistent. So again, a lot of trial and error on the part of ancient practitioners. Now, when the needle goes in, that's how the practitioner is going to try to produce the desired response. Now, obviously, in this day and age, like we just talked about, chi. It's not exactly discussed in that manner. This is going to be more things along the lines of trying to decrease muscular tension in order to produce relaxation, increase certain hormonal responses in order to help with digestion, relaxation, all these different components. So again, we have to use a little bit more in the realm of anatomy, physiology, pathology. So going back to that bladder line that we had talked about that runs up the back of your leg and into your low back. How many of us are familiar with the sciatic nerve? Okay. I guess that's what you say, struck a nerve. Oh, okay. I'm going to leave right now. I'm sorry about that. Anyway, so that line follows the sciatic nerve. So we are starting to find that some of these lines will follow major nerve channels. Other things too. Any of us familiar with fascia or muscle in some way? Yeah. So there's actually chains of fascia which link different muscle groups together. Now, for an example of the upper extremity, sometimes those channels will follow pretty closely with some other nerves. However, occasionally they veer off and they'll start to follow these fascial chains, which will link up the whole rest of the body. So again, using basic anatomy terms to try and explain why these pathways are the way that they are. One other thing, let's try and address this right now. Who here has heard of dry needling? Okay, we got some explaining to do. All right, so dry needling is another form of using needles to produce or to help with pain, muscle knots, things like that. Now, is there a difference between this and acupuncture? Yes and no. The biggest difference is that acupuncture is going to be having a lot of theory behind it. Now, there are ways of acupuncture veering off of these particular channels and points. So let's say if you have, everybody's favorite big muscle knot up on the top here, where we're going to, again, veer away from those points, surround that muscle knot and try to get that to relax. Dry needling follows this. So basically you're going to find the sore spot and you're going to poke it. It's very effective. It's, again, a wonderful, wonderful treatment for any type of pain symptoms. But again, with acupuncture, a lot more theory, and you're going to try to also influence things beyond muscle, joint, and pain. Does that make a little bit of sense? Yep. All right. So big question, how does this actually work? So I threw up a bunch of big words up there, but I'm going to try to make it as simplistic as possible. Needle is going to go in. The body senses that needle going in. Now obviously, anything that happens is sensed by the body, processed by the brain and spinal cord. Once that is being sensed, the body will then send that nerve impulse back to the particular site where that needle is. This can produce both a local response as well as a big overall body response. So in the case of something more local, this is going to lead to some type of a neurochemical that's going to cause either one, relaxation, or else increased function. So again, if you're deficient on something, it's going to help to kind of build that process back up. Likewise, if you're in excess of something, it's going to help to kind of down-regulate those things. This can also be seen widespread. So if we're treating somebody for, say, something along the lines of, let's say, anxiety as an example, that's going to produce an overall relaxation effect. So again, same neurochemicals, but they're going to produce both a local and a global response. Make sense? Okay. So this chart here is some basic research on a lot of different things out there that acupuncturists are known to work with. The top box is very, very positively acupuncture has been shown to help with. So things like any type of rhinitis, so nose-related issues. If you're undergoing chemotherapy, oftentimes this can help with nausea symptoms. Pain symptoms of very different types, anything from acute to chronic, is very, very helpful. Now, as far as other things in the second box, this is where we start to, the research is kind of hit or miss, but most of the time still very positive. So again, about that 70% C to B range, if that makes sense. So again, a lot of different things that acupuncture is able to help with. Is it going to be the one cure-all? Not necessarily. Oftentimes, especially in the case of looking at chemotherapy nausea symptoms, it will help amplify, say if you're already on some type of medication, it's just going to help ease that symptom of that nausea a little bit better. So again, not the cure-all, but definitely something that will help along those lines. There's still a lot of research being done at this point, and still a lot needs to be done to help out understanding why this works the way it does. So this is something I touched a little bit on right away as far as European styles. Right now there's a very, very popular form of acupuncture which is known as battlefield acupuncture. Currently this is being used by the United States military for injured soldiers. What happened is that, especially it was a Frenchman who started looking at specifically needling the ear to help out with symptoms throughout the body. Now this may seem a little bit far-fetched, but how many of us have heard of reflexology for the hands, the feet, things like that? Very similar concept is being applied to the ear in this case. So where somebody is going to massage or influence points on the hand to treat elsewhere in the body. Again, that's kind of this microcosm effect. Similar concept can be used within the ear. So on the far side there, that's the 5 points in the ear which are needled. That just overall, what research is suggesting is that this helps to decrease a pain gate theory. So it's going to be very much widespread. It's not going to, if you come in with a hurt big toe, it's not going to treat just the big toe. It's going to shut down the whole pain gate response to the body. Okay? Understand? Yeah. Now, the bottom picture here is actual battlefield acupuncture. Now, in the United States military, they actually have these little spring needles, essentially. It looks like a little earring that you shoot into the ear, and that's how they treat people in the battlefield. This particular form of treatment began to gain a lot of popularity post 9/11. What happened was that with all the first responders and emergency personnel at ground zero, people were coming away quite achy and sore. Well, a group of acupuncturists from out in New York started going over and saying, hey, there's got to be something we can do, and they started utilizing this Frenchman's technique for pain, just to help any first responders that were a little bit sore, achy, beat up from assisting those in need. And then from there, this has, again, gained quite a bit of popularity to the point of being utilized in combat right now. So some contraindications of undergoing acupuncture. Obviously, drug and alcohol intoxication. So if you're interested in undergoing this, don't go out and have a couple of drinks, okay? Also, too, things like use of a pacemaker, or if you've had a history of seizures. Sometimes that can just overstimulate the body in a way that, again, it's just not a positive response. Obviously, if you have any bleeding disorders, whenever you're sticking a needle in, there is some possibility of bleeding. Most of the time, this is pretty null and void. It doesn't happen, but occasionally there is a little bit of blood loss from the needling. Any type of active infections, again, with any type of breaking the barrier of the skin, that can increase the risk of infections, and if you already have an active infection, it could cause it to spread, which is the last thing any of us wants. Now, the last one, pregnancy. This is not necessarily a contraindication. However, various points along the body are known to stimulate the labor process. So most practitioners know this, and they try to avoid those at all costs, unless, of course, you're coming in for that particular reason, in which case, you know, hopefully your practitioner knows, hey, these are the points we need to use. All right, so a little bit to expect if you do end up undergoing this treatment. I had to, I'm sorry. All right. So first off, the room that the needling undergoes is very, very thoroughly cleansed. Again, we try to keep the risk of infection quite low. The needles, most of the time, at least the ones that I will be using, are single packaged, and they're actually sterilized beforehand, and then they're pumped with an ethanol gas, again, trying to decrease any risk of infection. They do come in what are called blister packs, which are just packs of 5 to 10 needles. Some practitioners use those. Personally, I will not. Now, when the needle is inserted, this should not be painful. Again, there are theories out there that do try to elicit that pain response. Now, this would be along the lines of like that dry needling, where you are trying to actively cause that muscle to contract and relax. But again, majority of the time, this shouldn't cause any type of pain. Now, during the treatment, most of the time people will be in a seated position, laying down. Again, you want to be relaxed to allow the body to process what's going on. And it's kind of tough to relax if you're standing up and you got needles in you. That's me, I guess, but everybody's different. One thing that can happen afterwards is that people sometimes tell me that, hey, I felt quite lethargic afterwards. I felt kind of drowsy for the rest of the day. Other people feel very invigorated. Again, it's very, very difficult to say because everybody interprets the treatment so vastly different, which is also why I included this, what's called a sympathetic response. Now, a sympathetic response is basically when your body is overstimulated. So think about it this way. You're getting chased by a bear. You're kind of sweaty. Your heart's racing. You're running as fast as you can. The body can actually have that similar response by getting needled. So again, you'll be feeling a little bit nauseated, dizzy, lightheaded, very sweaty. If this happens, make sure you tell any practitioner that practices acupuncture right away, because the needles need to come out. It's not necessarily a dangerous thing unless you have some of the other contraindications that we had talked about, but it's very unpleasant. Typically that'll last about 30 minutes, but things will subside. Oftentimes just need a little bit of rest, let the body kind of settle down and say, hey, I'm not in danger, I'm okay. Treatments usually last anywhere from 15 to 30 minutes, depending on, obviously, one, if we're treating, say, a shoulder versus something with digestion or something along those lines. Again, it's just very, very dependent upon the number of needles, how your body's responding to the treatment, things like that. Again, that's also another reason why most people prefer to sit or lie down as opposed to standing. Again, I don't know about you, but I don't really feel like standing with something stuck in me for 30 minutes. So, quick conclusion, kind of wrap things up here. Hopefully we gave you enough basic information to kind of demystify what this acupuncture treatment is. So, what we're trying to do is we're using needles to either upregulate or downregulate certain processes within the body. So, again, trying to increase something so that way your body does blah, or decrease something so your body isn't blah. Now, this is very, very effective in helping, obviously, pain. We've talked about nausea, things like high blood pressure, rhinitis, but there is a lot more research that needs to be done, especially with things like dizziness and other factors like this. It does show that it can be quite helpful. However, research is, again, a little laggy behind. I want to make a couple special thanks tonight. So this gentleman, Dr. Josh Bruning, he is a chiropractor and an acupuncture certified therapist in my hometown of Marshall, Minnesota. He and I were both classmates when we underwent this training. When I was asked to do the doc talk, I was able to contact him, and he was able to kind of explain how he was able to do the same kind of a talk back home in Marshall. So I wanted to say a great deal of thanks to him. Also tonight, all right, in the back here, my mom actually was able to drive up from Bemidji tonight to come listen, so I got to say thank you. So please everybody, you have a little golf clap. Thank you so much tonight. Thank you, everyone.